Welcome tonight to Lifestyle Medicine with UPMC Altoona. Just telling you a little bit about the FMEC. We are a 14-state and DC coalition focused mostly on medical education and residency training. In those 14 states, we have about 60 medical school departments of family medicine and about 190 family medicine residency training programs. We do a large annual meeting each fall. Hopefully some of you joined us last month in Arlington, Virginia for that. We had almost 900 people. We had a record-breaking residency fair with 89 residency programs present, and we brought about 300 medical students on scholarship to help them learn about family medicine and talk to some of the residency programs. So it was a great event. We also issue annual awards to people for their accomplishments in family medicine, but also some for art and literature. We run some learning collaboratives, and we have other ways you can get involved if you're interested. And really our focuses are threefold. We try and promote family medicine and primary care to medical students and encourage them to move into one of those fields. We support residents to both learn, have great learning experiences, to get presentation experiences at our meeting, and also to get out into their career by teaching them about practice models and helping them with their student loans. And we also help faculty and program directors at the residency programs connect with each other, network, present, and generally learn about family medicine. And with that, I just want to mention our next meeting is in 2023 in Providence, Rhode Island. It's October 13th through the 15th. So I hope you will join us there. And now I'll turn it over to our host tonight.
Thank you, Scott. That was awesome. I hope we can get to go to Rhode Island. It looks like I bet we'll have awesome fall foliage then too. That'll be really cool. So I'm Megan Maurer. I'm one of the faculty at UPMC Altoona Family Physicians, and I am in charge of our lifestyle medicine curriculum, which started last year. And so I was actually just going to give you a little intro to what lifestyle medicine is and what our curriculum is like at AFP. And then I'm basically just going to open it up to questions because I kind of want to make sure everybody gets all their questions answered about what lifestyle medicine is like, what our curriculum is like, and what our program's like. I do have some other things we could talk about if nobody has questions, but I'm really hoping that everybody can basically get answered what they want to have answered. So lifestyle medicine is basically using lifestyle interventions to prevent and treat, and in some cases even reverse disease. And the 6 pillars of lifestyle medicine are nutrition, especially whole food plant predominant diets, physical activity, sleep, stress management, avoidance of risky substances, and social connectedness. And so it's estimated that about 80% of chronic disease is caused by lifestyle factors. So, of course, lifestyle medicine can make a really big impact. And certainly it's, primary care and lifestyle medicine are really a natural fit together. And so, as I mentioned, we started our lifestyle medicine curriculum last summer. And at AFP, it's a track that residents can choose to participate in. But all of our residents actually get the lifestyle medicine didactics. So every month, either I or Dr. Katoy do a lecture in lifestyle medicine. Sometimes it ends up being 2, but it's usually 1. And the residents that choose to do the curriculum, the full curriculum, also get to do a certain prescribed number of patient encounters in each of the pillars. And they also do a certain number of hours in group activities, which can be anything from, we've done some fun like virtual cook-alongs, and we've done like walk with the doc. Really, it can be resident directed and whatever they really like to do. I know some of the residents have talked about leading some yoga sessions with the other residents. So really it's really flexible. It can be a lot of different things. And then there's also a number of hours done doing intensive therapeutic lifestyle change programs. And primarily we meet those hours by doing our weight management clinic. And we have that currently twice a month in our Altoona office. And we're actually expanding that to our rural office starting next week. It'll be our first session out there. And I'm hoping we'll actually get to do that twice a month as well. But for now, that's just once a month. And after the residents complete that curriculum, they're then eligible to sit for the lifestyle medicine boards and become certified as a lifestyle medicine physician from the American Board of Lifestyle Medicine. So when they graduate after that exam in their family medicine boards, they can be certified in both family medicine and lifestyle medicine. So that's basically a little bit about lifestyle medicine as a specialty and our curriculum at AFP. So I also wanted to, give a chance for everybody else here to introduce themselves and open it up for questions. Dr. Sweeney, did you want to go next and introduce yourself? Oh, you're muted.
I hope I'm not causing feedback because
No,
I got
you're
this phone. Amanda, why don't you introduce while I get this thing off?
Sounds good. I'm Amanda Catoy. I'm one of the faculty here at UPMC Altoona, Altoona Family Physicians. Excuse me. So while Dr. Maurer is already lifestyle medicine certified, Dr. Sweeney and I are two of the faculty that are going through the program concomitantly with some of our residents. So I'm still an active learner learning about all these things, but it's been a really interesting and exciting curriculum to be involved with, and I'm learning a lot, and I'm learning how to help my patients a lot. So that's been a lot of fun. I'm one of our OB faculty, and I am on call tonight. So if I suddenly disappear, that's what happened.
Hi, and thank you, Amanda, for buying me time because I didn't want to be the one that, you know, that you always, the person that makes the feedback is like, you know, the evil of Zoom. So I had to get that off. But yeah, I'm Dr. Sweeney. I'm the director of osteopathic training. I don't know if anybody's in DO school. I also direct a transitional year residency here, and I also am one of the associate directors of the family medicine residency. I love lifestyle medicine because it's just so congruent with osteopathic and family medicine philosophy. And I go to all the lectures, and sometimes I fall behind on the topics, but I mean the homework, but Megan assures me that someday I can just go to a meeting and take a test. But I think what's really exciting is that I see our residents also making a lot of healthy changes, and the faculty making healthy changes and helping our patients. That's the most, you know, gratifying thing to know that we can help people and help them when knowing that most chronic disease is all related to what we eat. And in America, we got that sad American diet going on. In fact, you know, just earlier, when I was bopping along and you guys are seeing me with the sky in the background, I was listening to the Curbsiders who had on this week lifestyle medicine. It is definitely something that Dr. Maurer has added to our program. And I think it's added to both the didactics and the whole atmosphere of the residency. Now let's see who
Thanks,
else.
Dr. Sweeney. I see Dr. Albert's there. He's one of our lifestyle medicine residents. He's a second year. If you want to.
Yeah. Hey, I'm Deep. I'm one of the second year residents. So yeah, I've been doing the lifestyle medicine curriculum for like the last year and a couple months. It's definitely been super useful and interesting. I think like kind of like what Dr. Maurer said, like 80% of like chronic disease is like lifestyle factors. But I feel like personally for me, in like medical school, we got like a very basic understanding of that stuff, like nutrition and exercise and all that stuff is such a big part of health. But the extent of what I learned was like, you know, tell patients about like the DASH diet or increase your exercise or stuff like that. Not really anything evidence-based or specific about how to actually talk to someone about weight loss or exercise or anything in like a more concrete way. So definitely kind of the stuff that we've been learning throughout the year has helped a lot with that. I feel like talking to patients, trying to get patients to make, you know, changes in their lives has definitely been a lot better. And I think it's something that I definitely try to learn more about my patients kind of whenever I'm seeing new people and stuff like that, making sure that I know about, you know, the diet, exercise, like sleep habits, stuff like that, to kind of be a little bit more holistic and stuff.
Yeah, I think one thing is nice about Dr. Maurer and Dr. Catoy's lectures is they always have an interactive part where we kind of try things out and kind of come up with ways that we can talk to people about lifestyle without making them feel judged or feeling like we think they're doing the wrong things. But it's a really, thank you, Ann Deep.
And then I know Caroline was going to tune in. Is she here?
She was in and out. There she is.
Oh, she's having computer issues, so that's why
My computer decided to freeze. I was like signing in and it just like completely froze. I'm one of the interns. So I just started the lifestyle medicine curriculum in July. But so far, like I've really enjoyed it. I like the activities. It's definitely helped me to kind of learn more. And I've already started becoming more comfortable, you know, asking my patients, you know, what's your exercise like? What's your diet like? You know, how do you sleep? more comfortable trying to talk to patients about smoking cessation. So I just will definitely improve throughout my time here, but I've already noticed a change.
Awesome. And then I know Alexandra was going to tune in too. Is she here?
I saw her.
Here.
Oh,
Can everyone see me and hear me?
There you are.
Okay. Yeah, so I'm Alexandra. I'm also one of the second-year residents in our family medicine program, and I am in the lifestyle medicine track as well. I don't really have too much more to add from what Anudeep and Caroline have already said. But Dr. Maurer, I wanted to mention that she came up with these like smart phrases that we can use in Epic that are all related to lifestyle medicine counseling. So there'll be a smart phrase for talking about healthy eating, for talking about sleep, for talking about smoking cessation, and that really helps me to kind of organize those lifestyle medicine counseling visits, because it kind of prompts you with, certain things to ask the patient about or things to discuss. So, and then that smart phrase is an automatic way to track the lifestyle medicine visits that we're doing, because we need a certain number to be able to take the exam, like Dr. Bauer said. Yeah, that's about it. So, and Anudeep and I are also working on a quality improvement project related to lifestyle medicine, but we're kind of stuck in IRB approval land right now.
You guys should talk about that because it's a really cool project.
Yeah, it is. It is really cool. So it was actually Dr. Maurer gave us the idea for it. And we're going to be at some point soon, hopefully, doing group visits or shared medical appointments. And the patients that would be involved in these visits would be patients who have type 2 diabetes, high cholesterol, or some kind of hyperlipidemia, and or are overweight or obese. And so they'll have, one of those three or a combination of the three. And we're going to have an individual visit with each patient first, get their weight, waist circumference, a baseline A1C, and a lipid panel, and then I think we decided on 6 visits over the span of 6 to 8 months as a group with maybe like up to 8-10 patients, something like that, and focus on lifestyle interventions, lifestyle medicine counseling. We're also going to try to do like a small cooking class in every visit, so that way they know how to make, certain plant-based whole food meals. And then at the end, we're going to have another, time to measure their A1C, their weight, and all that. And we're hoping that there'll be a positive change in all of those. So it's a really cool idea, but because it involves patients and drawing blood, apparently that's a risky thing. So the IRB has to approve it. So we're just in the process of like going through a clarification document for what we're going to do. And yeah, but it will happen.
Yeah, Dr. Maurer, it might be cool to let everybody know too that we really have worked with our patients in all different ways. We made a cookbook recently that has all sorts of recipes from faculty, and I think did some residents throw in some too, or was it mainly faculty?
I think it was mostly faculty. We're actually working with Penn State, with our Penn State campus up the road, doing some research and outreach stuff with them too. But yes, it's primarily our faculty. We do have a cookbook that we have given to some patients too.
Right, and then we also have every Wednesday the big boxes of produce come, and we try to get those out to our patients so that they can have some access, just encourage them to use, cook with more vegetables and fruits. And that's a fun thing too.
Yes, and through our work with Penn State, we do have someone who at some point is going to be coming in. COVID kind of messed things up a little bit, but at some point is going to be hopefully coming in to do some cooking demos and doing grocery store tours with our patients. So yes, we are trying to do all kinds of interesting things for our patients as far as education is concerned for lifestyle. So
I think one of the big things is that Dr. Beckstead, our director, has really given Dr. Maurer free range on this and total encouragement. In fact, just this week, he asked her to put in some more obesity lectures into our curriculum. And so we essentially will have at least 18 to 20 lectures throughout the year on lifestyle and obesity. And I think it's just absolutely apropos when you see what impact that has on our patients' health.
Yeah, so I'm also certified in obesity medicine. And when I did my yearly eval, he said, well, you know, what else do you want to do? And I said, well, I have the certification and I have like, you know, all these things that I think I could be teaching. And, you know, can I do that? And he said, well, sure, of course. And so, you know, so we're going to add a little bit of didactics there too. So, yeah, so I have to give Dr. Beckstead credit. He really does let us, you know, innovate. So it's been really fantastic. I know he was going to try to tune in, but I think he had some plans as well.
Yeah,
tonight,
I
so.
think the other thing, Dr. Maurer, is because that curriculum has been so active, whenever I'm precepting, I really feel like the residents are totally open to me bringing up, hey, do we ask maybe for a 24-hour food recall? Did we talk a little bit about maybe adding some vegetables, or what kind of beverages do they drink? So I think it's really kind of becoming ingrained in the entire residency.
I agree. So anyway, at this point, I have some questions that I could ask to talk about, but I would prefer to ask everyone who's here, you know, to see if you guys have any questions first, because I want to make sure you guys get out of this what you want. So, you know, I'll open this up. I see a hand from Olivia. Do you have a question?
Yeah, hi. Thank you so
Hi.
much for having this. I think I have a question and a comment that I like really wanted to say in the company of family physicians, because I'm currently on my surgery rotation and like hardcore miserable. I'm really wondering how you see lifestyle medicine fitting into a culture of physician wellness and a shift in Western medicine's perception of disease and how to approach it, treat it, and think about it. Because the way that I think about wellness, it starts with nutrition, sleep, and exercise. And that is what I want to focus on as a direct primary care provider in the future. And even while I'm with the VA, I have a scholarship through them, which I'm very blessed to have. But I'm so frustrated on my rotations that like, I was just on neurology and like, we talk to 0 of our stroke patients about what they're eating on a daily basis. And I'm like, what in the world? So what do? I just go talk to them. I don't ask permission. I mean, because my attending's not in the room with me, but I think that they would think it was ridiculous that I'm asking these questions. But I'm sitting here like, your diet is literally chicken wings, and we're just saving you from the precipice of death and then sending you home to continue to eat chicken wings. And I just like, I don't understand it. And it seems to me that no one else is like hearing this or like seeing it. And it's so frustrating. So basically I'm wondering, how do you think like lifestyle medicine will influence like that culture of medicine, but then also this culture of like overwork and self-deprecation that I see that is just so glorified in medicine. I write poetry about it, and I'm writing a lot of poetry about it this year. And yeah, it's a very unpopular opinion, and I get shamed for sharing it publicly, but I don't care. So yeah, thank you so much for having me.
You won't get shamed here about it.
I know, that's why I really wanted to share. Thank you so much for not judging me.
So 2 things I would say. So in our probably like very first lecture that we do about lifestyle medicine, we talk about the lifestyle medicine treatment pyramid, and at the very base of the pyramid is lifestyle changes. And so, and at the very top is things like prescription medication and surgeries. And so one of the basic concepts that we talk about is that you know, the very first line and base of our treatment strategy should always be lifestyle interventions. And, you know, you see that everywhere from hypertension to stroke to heart disease to, I mean, even things like, you know, depression and mental health, things like exercise have been shown to be very helpful for those kinds of things. You know, so that's one of the integral, you know, concepts in lifestyle medicine, and one of the very first things we teach. So it's definitely something in family medicine, but I mean, at our program, we really emphasize that that's always one of the first things we talk about. So of course we use all the tools in our toolkit, but lifestyle interventions are definitely one of the big tools in our toolkit. So that's the one thing that I would say about, you know, treatment strategies, at least for me, and I think for a lot of the people here on the call, like that's something we always try to incorporate into our treatment strategies.
You know, and Olivia, I think you can rest easy that this is not just a family medicine issue. I always attend American College of Physicians every year. They had at least 3 or 4 sessions on lifestyle medicine. As I told the people who were on earlier, I was just listening to the Curbsiders and they had one of the speakers on lifestyle medicine. I think you'll find more and more cardiologists really do get it. I think the entire system doesn't reimburse as well for it as they do procedures. So you're going to see that a procedure-based reimbursement setup is not going to go nuts over it because that's not how they get paid. So, I mean, and I think that's why direct primary care is just so important. And I highly encourage you to look into it. I'm sure you know about the July conference that started when Larry Bauer started it at FMEC, and now has been taken over by the AAFP. And I think that that's why the future of the health of the country is in people like family physicians and general internists that are willing to put the time into helping people make culturally appropriate lifestyle medicine changes. So don't lose heart, just hold the retractor and smile, you know, get through the rotation and know that there's a light at the end of the tunnel. Because people that understand health know that this is where this is the crux of the matter. So my hat's off to you. Don't get discouraged and don't get frustrated, because remember, you win more what do they say? Win more. Well, honey's better
Attract
than
more flies with honey.
What is it?
Attract more flies with honey. Is that what you mean?
So try not to get frustrated with people. You know, try to just, you know, throw you, but you don't have to be quiet either. You know, I think it might really help if maybe we explored what our what we can do to help our patient with exercise or what they're eating or drinking. But hopefully surgery will end for you soon. But I think you'll even find surgeons actually in Erie. I don't know if I have any LECOM kids on, but there's an orthopedic surgeon up in Middletown, New York, who works for LECOM, who actually teaches all the students in a big kitchen, lifestyle medicine, and then they go out into the community. And it was started by an orthopedic surgeon because she saw so many people suffering joint replacements because of obesity. So it's getting there, Olivia. It's just slow. But yes, I know orthopedic surgeons that actually care about it too.
And then to your other point, I would say that we have plenty of research showing that physicians that take good care of themselves and have healthy habits are more likely to counsel their patients about healthy habits. And so one of my goals about having this curriculum at our program was to help our residents have, you know, better habits and be more well. So you know, I do think that having this kind of education contributes to wellness of physicians as well. So I think that it plays a role in that too. I know for me, you know, 10, 12 years ago, when I started this journey for myself, you know, back when lifestyle medicine was like a fringe hippy dippy trippy thing to do, you know, it really changed my life and the way I took care of patients for the better. So I do think that it helps improve physicians' lives as well, like in their personal life as well. So I would add that point as well.
Yeah, Dr. Maurer and I often cringe because they have these food trucks that come to the hospital with deep fried Oreos, and we send each other the menu and we're like, oh my gosh, you know, so you're really fighting a culture. But we do our best. And I think that because of the curriculum, people can feel more confident as they say, like Dr. Rule brought a veggie tray when he brought the birthday treats the other day, because our office loves birthday treats, but he always makes sure he brings a veggie tray. So now it's really kind of getting inculcated into the residency that if you're bringing cupcakes, you better bring some broccoli too.
Just to piggyback a little bit off of what Dr. Maurer and I think Dr. Alberts hit on it a little earlier too, is, you know, to go off of Olivia's question there, this curriculum has really impacted my own choice making too. You know, I don't know about you guys. I don't know if things have changed since I was in medical school, but we got very, very little training in nutrition and, you know, macronutrients, micronutrients, those sorts of things. It was probably an hour one day that I vaguely remember. And truthfully, you know, you have some basic idea as to what's good for you, what's not, but But truly delving into more of the curriculum, you realize that some of the choices that you're making that you think are good for you are not necessarily good for you. And that has helped me both in my own life and in talking to patients, because, you know, your patients come in and they say, oh yeah, I'm eating great. You know, I eat a hamburger and we're eating like whole wheat buns, and, you know, I stopped putting bacon on my hamburger, so I'm super healthy now. And talking to them about, you know, truly what a whole food plant-based diet looks like and how that can impact your health. It has been a great tool in my toolbox to be able to use, not just for my patients, but for myself and my family as well.
You know, and I think that's why I like the cookbook, because, you know, you can't ask people to do real elaborate cooking, but, you know, just to teach them how to mash pinto beans and, you know, make a simple meal out of that. That I know that was our recipe. It was kind of like a bean burrito recipe. Things that are affordable and easy that kids like. We really try to help people with those. Olivia, how did we do on your question?
You did great. I guess something that I'm still wondering is how you feel lifestyle medicine plays a role or does not play a role in addressing like factors that I feel contribute to physician burnout, which I think is mostly because our values are being stepped on one hand, which is a whole conversation in and of itself, but also physicians aren't given the time or space or encouraged to take care of themselves at all. And I'm wondering, like, programs that have lifestyle medicine curricula are trying to like set the example or not. Like, I personally advocate for myself, and I'm like, I'm going to CrossFit 3 times a week, and I don't really know when that's going to happen, but you're going to tell me as my resident, and like, I don't care if I don't honor this rotation. I want to learn a lot, but I also like want to take care of myself.
Right.
Like,
And I think that like in our residency, UPMC is very good about trying to really support residents in wellness. And I'll say a little bit that Mina probably could chime in, but we have an active fit membership that for $25 a month, we can go to all the gyms in town. We have pools and like 4 facilities at least to choose from. And then, you know, as a whole, our GME department always is making sure that we have counseling available. And we try to encourage our residents, like we put weights and don't we have a little, last I looked, a little treadmill up in the conference room?
We do, and it works.
Yeah, so we try to let people, you know, if you're on call, to get a little exercise in. And then I always torture the residents and make them walk up 14 flights, which
you do.
Mina, can you talk a little bit about the wellness at our place?
Yeah, so we have the Active and Fit, like she said. We actually have an OMT table and frequently adjust each other, which I just want to highlight is amazing after a call shift or before a call shift. We also have Wellness Wednesdays, sometimes on a Monday, depending on how noon conference goes. But either Wednesday or Monday every single month, we don't have a noon conference, and we get to just kind of hang out with each other, and we get a free catered meal. It's been from Chipotle in the past, Olive Garden, just kind of some local eateries. So that's always fun, and I think really important for wellness. We also have resiliency rounds, which our current chief, Aaron, started. So COVID got pretty dark for anyone who has loved ones that are in the healthcare field right now. It was a lot to deal with, and it became a safe space where residents can kind of vent and lean on each other, joke around, talk about cases they're proud of, cases that depress them, kind of open grounds to kind of deal with big problems on big days together. So I think that's really important for wellness too. And we have Lynn, who is a social worker that we can talk to at any time. She will meet us anywhere, talk to us on the phone whenever, and kind of talk us down after a really hard case or help us cope with things. And everyone finds a resident or a faculty mentor that they go to. So I talk to Dr. Seams really frequently, and Dr. Maurer and Dr. Sweeney and Dr. Katoy, and honestly a lot of you guys, because you guys are so great to talk to after a really bad day. So I think that really attributes to wellness as well.
So I also wanted to address, I think one of the things that Olivia was really asking is that how lifestyle medicine in general also can address burnout, and not even just at our program, but in general. And so one of the things that I wanted to mention is that I think when you're treating patients, not just with medicines, but also with lifestyle changes, you actually do see improvements in health and you see patients who are empowered to make changes that they are making in their own lives. And it's really satisfying to see patients who are motivated and feel really excited about their health. You know, I'm in charge of our weight management clinic. And for instance, you know, we had a patient come in today and we hadn't seen her since July. And I was really worried, like, what happened to her? And, you know, since the last time I saw her, she's lost 30 pounds and I didn't even recognize her. And she's been following all this stuff on her own and just got busy and hadn't been able to come in to see us. But like, I didn't even recognize her. And you know, it's just really cool and really satisfying and really helps with burnout when you actually enjoy what you're doing and you can celebrate victories with patients like that. And I just really think that that sometimes is missing when you do, you know, only medicine based, like, you know, just pills and labs. And, you know, it really brings something to medicine that is joyful and I think helps with burnout. So that's one thing I did want to add as a whole, not just at our program, but as a whole, I do think lifestyle medicine helps with burnout in that way too.
And I was wondering if some of the residents can comment on, like, I really think that most of our residents do exercise and do try to make some efforts towards healthy eating. Can you guys tell Olivia a little bit how you incorporate that wellness into a busy resident life?
Yeah, I can. I go to the gym probably 4 to 5 times a week. I started out on inpatient medicine, and there were a couple weeks where I was 3 times a week, but I would get up at 5, go to the gym 5:30 for 35, 40 minutes, change, shower, change, and head off for a sign out. But you make time for it. The gym is one of those things that's a stress reliever for me, so I make time for it because I also enjoy it, but it helps relieve stress. So I think it was pretty important for me to like start off strong, like start residency off with like keeping my habits. I'm not a morning person at all, but that's really the only time that I could find that I was like, I can definitely fit it in here. After a 12-hour day, probably not. I just want to go home and eat and go to bed. But in the morning, it's nice and quiet, and you have time to yourself, where you're not really thinking about patients, and you're like, all right, I'm just going to enjoy the gym.
I do see some hands up. So I think Merlene, were you first? I think your hand maybe was up first.
Yes, I was. Thank you for hosting this. My question was, I know that you mentioned with lifestyle medicine, social networking is one of the pillars.
Mm-hmm.
So are there like different type of community outreach events or programs that the residents are part of? And if so, if you could tell me a little bit about them.
So as a part of our lifestyle medicine curriculum, I don't have any specific groups, but we do talk about the importance of, in our didactics, the importance of people having, being part of a group of some kind, whether that be, their people's family groups, or whether that be a spiritual type group, or whether that be volunteering. Certainly the residents definitely do kinds of social outings with each other. We make sure that twice a year they have their resident retreat, where we basically run all the services and the residents have the day without their phones or pagers, and they get to go and hang out with each other. So I don't know if the residents want to chime in with some of the other social things that they do. Maybe.
I haven't personally done it, but I know some of the residents did like the walk with a doc stuff with like groups of patients and stuff like that. So I think that in some ways kind of getting a little bit of community outreach and stuff.
I know Dr. Sweeney has done the walk with the doc. I was scheduled to do it and then it got canceled because it rained. So.
I think that whenever Dr. Beckstead and I have any opportunities to get the residents out, whether it's Altoona Mirror Moms, which is at the mall, some of this stuff kind of faded away in COVID because you didn't have the big gatherings, but we always went to Altoona Mirror. There was like a big moms and kids and family day over at the mall to kind of help people learn about some health concerns. So I'm hoping that we get more and more into that community outreach, because we are a smaller community and we can really, I think, make impact. One thing that's nice is because physicians are pretty much looked up upon in our community. I think if we come out and support things like lifestyle changes, I think it makes an impact. So does that answer your question, Maureen?
Yes, it does. Thank you.
And I think Ben also had his hand up.
Yeah, I did. So it's good to hear about lifestyle medicine, because I just certainly want to do that in my practice. I haven't really gotten to see much of it so far. I was wondering what the logistics are for offering that to patients and what the patient experience is, because I know one of the barriers to talking about lifestyle medicine is not just the preparation and education for the providers, but also having the time to do it. So like, I don't know if you have a set aside clinic block of appointments your patients can get referred to that, and if their insurance will reimburse for them to have a visit to talk about that. And it sounds like you all have plans for doing group visits, which is a practical way to, I think, approach some logistics. But I'm just wondering, what's the patient experience like?
So I'm actually going to ask Mina to talk a little bit about this, because I know she has some patients that she has brought back routinely for lifestyle medicine visits here at our rural clinic. Because you don't end up addressing everything in one visit. You know, inevitably you bring people back multiple times. So I don't know, is Mina, are you still on here?
I don't see Mina.
Did she have to go? I know she was at home with her baby, so maybe she had to go.
Yeah. I do see Dr. Beckstead though.
Oh.
I see he joined us.
Everybody, how are you? I'm program
Hi.
director. How's everybody?
We're doing good. They were just asking, Ben had a question about how we incorporate it into our visits. You know, Ben, I think that we learn skills like, okay, at this visit, I'm going to find out where the patient wants to go with this. How interested are they? I don't go and give a big speech and tell them what I know. It's pretty much, hey, I want you to just know that one option for helping your diabetes and hypertension does involve what you eat and drink and how you exercise. Are you interested in learning about any of that today? And then find out where they're at. And so, it's really patient directed. I might ask them to do a 24-hour recall of what they've eaten yesterday, which is a quite quick way to get a snapshot. And then because we're family docs, we have that continuing care. We also have Dr. Maurer is very good about giving us resources, such as websites like Forks Over Knives. And so you'd have to tell them some of the other things, Dr. Maurer, that we can refer patients to if they want to get more information. And then we have our cookbook. We also have Jody in the office, our dietitian. So a lot of times I'll get things started and then I'll run out and I may ask Jody to see my patient. And if she can, she'll see them right there that same day, and that can get things launched for me.
Yeah, I think I'm sorry, go ahead, Kathy.
No, you go ahead.
Well, I was just going to say, I think it's important to assess a patient's, stage of readiness for change. Sometimes patients really want to hear you out about something, and sometimes they're really just not interested, and it's better to know that and just stop, because, if they really don't want to hear your spiel, it's probably better to save it for another time. So and you have that relationship usually with your patient. And I usually, for instance, if it's smoking cessation, I usually say to them, well, we'll probably talk about this again, because I wouldn't be a very good family doctor if I didn't talk to you about quitting smoking every so often. But, I'm always here if you change your mind or something like that, but I certainly don't try to address every single lifestyle intervention at every single visit. And I often ask them, would you want to talk about increasing your physical activity today? Or, your A1C isn't as good as it was before. Would you want to talk about ways that we can, change your diet? Or would you want to talk about ways that we can change your physical activity, maybe walking after meals to help your A1C come down, things like that?
Yeah, Dr. Maurer, I definitely ask them, what would be fun for you? Would you rather think about ways to eat differently or different beverages or exercise? And it's funny, they never pick beverages or exercise because none of them want to change those things, at least in my experience. But yeah, we let the patient run it.
Yeah, and I was just gonna add, I'm trying to do a little bit more visits that are focused on, you know, lifestyle medicine counseling, because I like today I noticed I had a patient that the last time I saw her was March, and like we first talked about you know, she's like obese BMI, and we talked about ways that, you know, she could change her diet, and I did like the smart phrase for the healthy eating, and she has this kind of long-term goal over like at least a year or so to lose 100 pounds, which is like a pretty big goal. But I think she can get there. Like she's very motivated, and I hadn't seen her since March. And like since then she's maybe gained 7 or 8 pounds. And it's like, oh, you know, what happened? And I guess like she had her gallbladder out, and then she sprained her ankle, and you know, all these things have just been happening, and she has young kids and stuff. So I'm like, you know, that's okay. Like we had other stuff to deal with at the visit today, but she's going to follow up with me you know, soon to just focus on that. So I'm trying to go back into, you know, the patients that I know I started talking about it, but maybe just they haven't followed up with me as closely. So I think that's something that, you know, I can improve on, is kind of like keeping track, maybe in like a separate Excel sheet or something, on the patients that I've already started the process on, because it's so easy for people to kind of get lost to follow up, I guess. So yeah. But I agree with having a rapport with them, not just like first visit, establishing care. Hey, you're overweight. Let's talk about exercise. Like that's not really the way to do it.
And I think we had a comment in the chat earlier about being culturally appropriate, and I may not be saying your name correctly. Falake, is that right? I don't know if I got it right, but I think it's just so important. You know, you have to, like, people aren't going to change everything they like to eat. You know, it's just like the other day, I had a patient with low potassium, and we were talking about greens, and her girlfriend said, well, collard greens would be good, and this would be good. Yeah, those are great. And so we went with the, you know, what she liked to eat. And I think that's just super important, to follow people's, you know, culture preferences and what they grew up on, and how can we tweak it a little bit so it's healthy.
Was that the patient you saw with me, Dr. Sweeney?
I think it was, remember?
Yeah, I remember. Yeah.
Yeah, and we were talking about green beans, and then they had better greens than I had in mind.
Yeah. Yeah. By the way, her creatinine got better. She got labs rechecked. Everything's
Well,
good.
that's a good thing.
Yeah.
I do have some websites. Jody, our dietitian, and we both have some websites that have, you know, specific cultural, different recipes and things, so that if the residents have, you know, questions about like, well, what can I offer this patient that's healthier, you know, particular type of cuisine. I mean, I do have other resources for those kinds of things. So I mean, we do try to be sensitive to that kind of thing and ask patients, you know, what would you like to have, or like, what kinds of things do you like to eat?
You know, what was interesting, Dr. Mowers, one time at an FMEC about 1 or 2 ago, there was the presentation by some 4th-year medical students about how to make Indian food healthier.
Mm-hmm.
But there was a lot of ghee, which is like a clarified butter, and different things that aren't so healthy. I never knew Indian food wasn't healthy. I thought it was good for me. And the 4th-year medical student's mom cooked us some Indian food. It was a very good presentation, very delicious, and showed us, you know, how you could make that healthier. So those are all just really important things to keep in mind.
And not just the cultural recipes, but also things like, you know, who's cooking in the house, and, you know, do they have children at home, and, you know, all those kinds of things. So for instance, I have, you know, patients that have family members at home who are absolutely not going to change their diet. And so we work on things like, what are they eating at work, and what are they eating for breakfast, because their dinners are absolutely not going to change, because they have other family that cook their meals and they're absolutely not willing to change their dinners. So, you know, all that kind of stuff, all the social things that go into diet. You know, diet is so integrated into people's family lives and their culture and all that kind of thing. So all those things need to be taken into consideration. All right, I think,
yeah,
I'm sorry.
I was going to say that one thing that's kind of cool about lifestyle medicine is our residency, we're really full spectrum. Dr. Katoy delivers babies. In fact, I couldn't find her picture on there, and I was afraid she had gotten a call from the OB floor. But we take care of people in the ICU. We take care of people in the office, from babies to elders. And lifestyle medicine, I think of as the cornerstone of everything we do. And as an osteopathic physician, I use osteopathic manual therapy, but I can't overcome with my hands somebody that doesn't move their body, that's eating really poorly, so it's making them really tired. So it's really just, it's all one unit, and that's an osteopathic concept, and it's a family medicine concept.
And I saw another hand. Is it Olamide? Is that how you say your name?
Hi, everybody. Thank you so much for this topic. Very, very important. And I'm really, really glad I'm part of this discussion today. My question is, most of these patients, when we talk to them in the clinic about smoking cessation, do we give them like options, like what they can do? Some are actually willing to stop smoking, but do we like give them referral to some smoking cessation groups, anonymous groups, like nicotine patch? I mean, something else. I mean, do we offer them such options out, like make them okay, yeah, these are some options you can do, though not being judgmental. I mean, we'll develop rapport, and then gradually we talk to them about the different options and make them make a choice by themselves. And also, I was also thinking about the exercises and the physical activity. I see that most patients, if we give them options of like maybe free gym membership or reduced gym membership, or they're more likely to oblige than say, okay, you need to exercise, you need to do this. But if they say, okay, these places offer cheap services, you can try these places, you can try this website, you can get office, maybe those can like encourage them to want to change their behaviors and I mean take up our advices, because they always want like suggestions from us to help them to make such decisions. And also, as regards the nutrition, it's very true about the cultural diversity, the family, and sometimes also when we talk about, like you said about the different food they eat, sometimes like they eat fast food in the morning, or maybe at work they take something fast food, sometimes like when we just talk to them and say, oh, how is your regular daily food? Let's see. How do you eat in a day? I mean, do you eat more at home? Do you eat more outside? I mean, so we can just have an idea of how they eat, and then we can talk about where they eat more, who cooks the meal, and all of that. I think all of that can help change or modify their behaviors and maybe help to improve their health at the long run.
Mm-hmm.
Yeah, that's my suggestion, I think. So, yeah, thank you.
Yeah, those are all good points.
Yeah, and I will say in our weight management clinic today, for instance, we, often when patients come in and want to go to the gym and they're concerned about cost or that, we often will look up in their insurance plan and try to figure out if they have a benefit like ours does with the $25 a month, the gym thing. For instance, we had a patient today who was concerned about childcare at gyms. And so we, tried to help her figure out which gyms would help with childcare, like our Y does that and the Summit does that. So, we certainly do try to be sensitive to those things and help people solve those issues. So, I mean, I agree with all of your points. So, did anyone else have any other questions? Raphael, I see your hand.
Yes, thank you for hosting this event and letting us in to participate here. So I would want to know, as you were talking about lifestyle medicine and the relationship with treatment of chronic disease, any recent experience with treating patients recovering from COVID during the pandemic?
I don't specifically have experience with, you're talking about like long COVID, you mean, or just in, I don't have any particular experience with that. I don't know if anybody else does. I mean, I know that there were plenty of lectures on lifestyle medicine, and of course, there were risk factors for COVID with obesity and diabetes and things like that. And so certainly, lifestyle medicine plays into it in that way. But I haven't actually used lifestyle medicine as far as treating long COVID or anything like that. I don't know if anybody else has any experience with that, but I have not personally.
Thank you.
I think, Raphael, one thing we did learn with telemedicine is that you can encourage people, at least not directly when they have COVID, but when we had telemedicine, try to encourage people still to be active, and you can be outside. There's no reason you can't go for a walk, even if the gym's closed. So we certainly try to encourage people to stay active and enjoy the outdoors.
Anybody else have any other questions? I see a hand for Cindy.
Hi, I'm sorry I was a little bit late. I'm actually a resident at in in central New York, and I was wondering, I don't think we have like lifestyle medicine at my program, so I was wondering, but I did take like lifestyle medicine as a course when I was a medical student, and I don't know if you have suggestions about how I can feel empowered to do some of these like interventions at my program, because like I feel like it's not part of our culture. And there are some things like healthy diet and exercise, but all the other things like plant-based diet and things like that. I was wondering if you have suggestions about how like I as a lone intern can feel empowered to like have patients come back to discuss lifestyle medicine things.
Sure. So the American College of Lifestyle Medicine has a conference every year. And as a resident, I'm pretty sure they discount their membership rates for residents and students. So, and they have lots of, online courses and things like that. So you can always go to the conference. And I think they do have it virtual, because I'm actually attending virtually this year because it's in Florida, and I have 4 children, so I can't just pick up and go to Florida, although I wish I could. So they have a conference every year, and they do have lots of online educational modules that you can take. And, it's certainly something that you can incorporate into any of your clinical encounters when you see patients. So I think it's something that, there's also interest groups that the ACLM has. You could participate in those as well. So if you were to become a member of ACLM, I know that there are interest groups that you can participate in as well. And I think if you have other residents at your program that are interested in it, it's certainly something that, you guys could, as a group do CPI projects together on, or, I don't know what kind of EMR you guys have, but you can even do your own smart phrases and try to help each other incorporate it into your visits together. So, I think it's certainly, there's educational resources available, and I will certainly put my email in the chat. And if you'd like to email me, I can help you find those resources. So those are the things I would start with. Their conferences are usually, very accessible. Even if you can't go virtually, they have all the stuff available virtually.
Dr. Maurer, that question reminds me too of one of the unique parts of our program is we have a thing called an ICC, where if somebody wants to concentrate on lifestyle medicine or OMT or dermatology or procedures, they can do that throughout their residency longitudinally. And I don't know if you could talk, I don't know how your residency works, but is there a way for you, whether like Dr. Maurer said with a CPI project or with some other experiences, that you could build that in? But that is one thing that is really cool about our program, is there's a ton of flexibility. So if you're really passionate about something, you can really pursue it.
Did that answer your question? Was that okay? An okay place to start?
Yeah, thank you.
Okay, sure. And then I see Marlene, you had your hand up again.
Yeah, I wanted to know if you guys could talk a little bit about overall for the program, if you anticipate any changes in the area that you live in as well.
Changes to the lifestyle medicine curriculum, or
just the program overall? Like, are there any things that you're going to be incorporating in the next couple of years?
I could jump in for that one if you want for a second. We've been kind of in the process of adding team members for a number of years. So we started off with our patient care coordinator, and then we added the PharmD, and then we added a social worker, and then we added the dietitian part-time. So the other piece of the puzzle that we've been looking at is embedded behavioral health. to actually have a therapist who was in our office who could do like marital therapy and psychotherapy for patients and do acute interventions if they needed to. We do have a social worker, so we're capable of doing some of that stuff now, but I think I'd like to get some embedded behavioral health, especially with the way there's such a shortage of availability of behavioral health at most places these days. So I think it'd be really nice if we could get that into the office. It'd be nice for the patients and it'd be nice for the residents training too. So that's one of my goals for the upcoming year.
Awesome. That's so great to hear, especially when you talk about psychotherapy and marital therapy. So you're just tackling all aspects of life. So that's great.
It kind of ties in a little bit with the lifestyle thing too. It's all part of the same game.
I would love to incorporate that into our weight management clinic too.
Yeah, that would certainly help.
And actually, from a lifestyle medicine perspective, I'm hoping, barring, I mean, I would really like to incorporate some culinary medicine into our lifestyle medicine curriculum. So that's one of my long-term, like, dream goals is to have a teaching kitchen to use not only for our residents, but also possibly for patients as well. So that's one of my long-term, like, one thing I would love to do. So, because I also really like cooking. So I'm happy to help teach people to cook too. So
Dr. Maurer and I have spoken about that kitchen before, but I had my monthly meeting with my boss, who's the CEO of our hospital today. And I brought that up to her today. I said, hey, we've been talking about this kitchen thing at our office. We want to get serious about maybe trying to put a proposal together. And she was getting pretty game for it. So I think we need to go for it.
Yay.
Yeah, I know. That's what I said.
Now I just have to figure out how to, like, I don't know, do a proposal for like building stuff. I don't know anything about that.
Well, see, that's where we have we use all the different facts. So you do the proposal for like what the nuts and bolts we need. I'll do the money part. Dr. Rule's the architect in our group, so he'll take care of that too.
Okay.
Well, another thing is I used to volunteer at the Ronald McDonald House, and that's where I used to cook for the patients and their families. So maybe you can look into that and see if we can incorporate it some way for the kitchen.
Very cool idea. Thank you. I told my husband that I thought I should incorporate him because he really likes to cook too, but he wasn't really all that on board. So
How about if we hire him?
I tried. I don't know.
Dr. Maurer, we're getting near the end.
I know.
Maybe we should have a wrap up and just kind of give them an overview of our residency and a wrap up on lifestyle medicine.
Yeah, I was going to say there's only 2 minutes left. So I don't know if anybody else has any other questions. I'm going to put my email in the chat. So if you guys have any additional questions you think of later, you feel free to email me. And I don't know if Dr. Sweeney or Dr. Beckstead or any of the residents want to put their emails in the chat as well. And I don't know, is someone keeping track of who's here that we can have a list as well?
I did keep track of everybody that signed in, so I can make sure you get their names.
Okay, wonderful. And then Dr. Sweeney, did you want to add any last minute things?
Well, my only last minute is, hey, come see Altoona. It's a great place. We have a wonderful family medicine residency. We're a very collegial place. Our faculty and residents are absolutely terrific to work with. We take care of everybody from babies to elders, do everything from deliveries to ICU. And we love our residency and we love sharing it with others. So, take a look, and we hope to see you in Rhode Island.
Absolutely. I liked it so much that I graduated residency here and then I came back. So
Thanks to Scott and the FMEC for facilitating this. Appreciate it.
yes, thank you so much.
And thank you everybody at Altoona Family Physicians. This was great.
All right, thanks everybody.